Jessie. I'm a registered nurse, and I'd like to tell you a little bit about myself. So I'm from the Niagara region. I grew up in Niagara-on-the-Lake with my family. My dad actually grew grapes, that's why we're in Niagara-on-the-Lake. I attended school for university at Brock University here. I did 4 years in the Honors Bachelor of Health Sciences program. And then I moved out of Niagara to go to Toronto, to University of Toronto for their nursing school. And it's notably the #1 nursing school in Canada and #2 in the world. While I lived here, I volunteered at the distress center, doing taking the calls that came in there. I also was a dance teacher to many students up at Center Stage in Niagara Falls. I was a part of the Med Plus program at Brock, which is what led me into a nursing career. Currently, I work as a registered nurse in London at their orthopedic and trauma surgery floor. I also work here in Niagara with the sexual assault and domestic violence program. And of course, I work here at Vanity Salon and Aesthetics by Elisa. I decided to get into aesthetics because I've always been into skincare since I was in high school. I've been a longtime client of Elisa's when she was back at Visage. So I've always done microdermabrasion. I've tested different skincare products, whether it be the Visage line, even some different medical grade skincare lines. I'm in now the Eminence line, which I'm totally in love with and obsessed with, that we have here at the salon. Hi, we're going to talk about Botox. So this is Xeomin, the product that I use. It's a neuromodulator, essentially, is what Botox is. So it causes the muscle to stop contracting. And why is this good for wrinkles? So wrinkles are actually formed, especially in your face. So certain areas that you would notice them are in the forehead, in between your eyebrows, in the crow's feet. Some people see them around their mouth. And it's just due to muscle contraction that happens over time, and it creates a line. So we have two sort of types of wrinkles. There's dynamic wrinkles, which are the ones that you'd see when you make a facial expression. So if you're squinting or things like that, those are the ones that are going to form. And then over time, as you continue to make that facial movement, they're going to become static lines. So for Botox, it's very important as soon as you start to see a line form to come and see me and get it taken care of so that you don't have a static line form. It doesn't mean that Botox doesn't work on static lines. They do. It's a lot harder to get rid of. You need to use more units, have more treatment sessions, and it might only soften the line if it is a very deep line. It might not be able to entirely get rid of it. If you come and see me early and get your dynamic lines fixed, it'll be completely gone and you won't have any issues and you can age gracefully. Hi, let's talk about some filler. So this is Bellaterra Intense, one of the fillers that I use. You can also see in it contains lidocaine, which is wonderful because that is an agent that when it's injected, it causes numbing. So this becomes pretty not so painful. So with this, basically filler is hyaluronic acid, which is a product that you have already in your body. And as we age, we tend to lose hyaluronic acid, which is what causes our face to be more plump. So when you're young, your face, usually you don't have any sort of sagging around here, but as you age, you do. So filler can be used for volume loss anywhere you may find it. So oftentimes people will come in and get their cheeks done and lifted, which is good for multiple reasons. It lifts the face. You don't have any sort of those jowl lines, as well as the nasolabial fold area. If you find that you have a very heavy line there, filler can fix that as well. People also too, like not even wrinkle related, find that they have small lips. So they like to put a little bit of filler in there just to hydrate them and plump them up and give them a more fresh look. Filler, I think there's a little bit of a taboo about it. People think they're gonna walk out of here looking like they have a duck face or that things are a little bit abnormal than where they were before because you're kind of changing the structure of the face a little bit, but it shouldn't be like that. If you're with an experienced injector, it should just make your face look more symmetrical. It should basically highlight the natural beauty that you do have, and make you have a little bit more of a fresh and awake look. So this is the Eclipse micro pen. It's used for microneedling. I'm just showing you in here. So for each client that comes in, you get your own disposable cartridge, which has 12 surgical steel needles at the top of it. And basically what it's used for, microneedling, is to cause controlled injury into the skin. So why this is good for you is basically it's causing the cellular turnover that you're looking for to achieve clear skin. So how it works is those tiny little microchannels allow hyaluronic acid or the platelet-rich plasma to be absorbed into the deeper levels of your skin. It won't just sit on top or go slightly into a pore. It goes like through that channel that I've made with this down to the subcutaneous layer. And in there, the hyaluronic acid or the PRP is able to cause the healing properties that you would need in order to target things such as fine lines and wrinkles, any sort of scarring that you have on your face, whether it be acne scarring or from a traumatic experience, any of the pigmentation issues that you may have related to the sun or from acne. So we're going to talk platelet-rich plasma or PRP. It's also called the vampire facial if you've ever heard of it. So platelet-rich plasma, basically here's the centrifuge that I take your blood, I spin it in here, and it separates the red blood cells out from the plasma and platelets, which can then be used for facial rejuvenation or even for hair restoration. So things like a receding hairline or just hair thinning from hormonal factors. Sometimes people with thyroid issues might have some thinning of their hair or alopecia. So you do have to have a hair follicle, so sorry for you people that are already bald, it doesn't work on that. But basically what the plasma does is it gets your stem cells, and it's really good for initiating for facial rejuvenation, collagen production, kickstarting that process. As we age, we tend to lose collagen and elastin. So by using this, it boosts that in your skin because it is those properties in the platelets. So you're able to fight things such as wrinkles, any sort of dark spots, uneven skin tone. This is wonderful for that. Hi, so I'm here to talk about sort of how the medical directorship works in my practice. So the doctor that I work under is Dr. Kofi. So he's located up in Hamilton. He's the person that I get all of my products from so that we know that they are safe, they're Health Canada approved, they're prescribed by a physician, and he also oversees my practice. So he's the one that we go and do trainings together. He also will tell me sort of what sorts of units to do. If anyone has any sort of concern or something where they think that they might not have, they're not sure whether they can get Botox or not, I have my knowledge to work from, but I also have Dr. Kofi to work from as well. So I can always message him, phone call him, and get sort of that knowledge from him as well on how we can help best serve you to achieve the goals that you want to achieve. You're looking to book an appointment for Botox and fillers, so the best thing to do is if you're unsure about it or you have any questions, come in, make an appointment with me, and I can tell you exactly what we can use to target your skincare goals. One of the most important things too is a lot of people want to get Botox. It's not an immediate effect. It'll take up to 2 weeks to achieve your the optimal effect. And then it's best that you come back and see me so I can see how the Botox has worked for you. That way I can adjust whether you need a little bit more units so that you get the full 3 to 6 month longevity out of your Botox. as well as I can see that it's worked. If it's sufficient and you don't need any more units, then I know for the next treatments that you have what works for you and your face. With filler, it's also important that it's an immediate effect. You will have a little bit of swelling, but it also takes 2 weeks for everything to kind of settle into your face and us to see how that has worked for you. So if you come back at the 2-week mark, we can adjust whether it's good for you or not. It's also one of the main things too is don't book these appointments like the day before you have something to go to. These are injections, so bruising can be a result of them, and even if you didn't bruise the last time, you might bruise at subsequent treatments. It's independent of each other. So because you can bruise, it's best not to do this like 2 weeks even before your wedding if you've never done Botox before. You might like the look of Botox and some people might not like the look of Botox. So it's something that you should do in the year leading up to your wedding or a special event or whatever you want to do it for. And then that way you know how it's going to react for you and whether you like the look or not, and then you can maintain that for your special day.